Good evening, everybody. My name is David. I'm taking SpCo151 with Professor John Marlow. My 3D topic is how to deal with first aid emergencies. We're going to go over some things. As far as dealing with first aid emergencies, we're going to talk about the definition, give you some examples, give you some steps to follow. We'll go over some scenarios after that, and we'll take any questions. Okay? So what is the definition of first aid? Well, the Webster Dictionary has it listed as an emergency care or treatment given to an ill or injured person before a regular medical aid can be obtained. So basically what that means is you're the first one there. There's no ambulance, there's no medical staff around. You're going to be helping somebody that's either ill or injured. Some examples of this is if somebody falls down, they have cuts and scrapes, bruising or bleeding, if they pass out. Another bigger one is chest pain and jaw pain can signal things such as a heart attack. If they have altered mental status or drooping in the face, it can signal things such as strokes. Some really severe things that you'd be looking for is motor vehicle accidents and industrial accidents. So steps to follow during a first aid emergency. The utmost thing you can do is stay calm. You're not going to help anybody if you're just running around like a chicken without a head. Okay? You're going to look at what's going on around you. Is it something that's small? Is it something that's big? You're going to render aid if you can. If it's a small scrape, you can help them by stopping the bleeding. If it's something bigger, you're going to move on to part 2. You're going to go and get help. You need to call 911 right away. The faster EMS gets there, the faster that person is going to get the help that they need. It may be the difference between life and death. Okay? When you're on the phone with the dispatcher for 911, you need to be prepared to answer any questions. They're going to ask you, where are you? What's going on? Above all, once you answer those questions, they're going to be able to help you. They're going to tell you exactly what to do. If the person's not breathing, they can actually teach you how to do CPR over the phone. Okay? It's something that not a lot of people realize. They're like, I can't do this, I can't do this. No. The dispatchers are trained to teach you exactly what to do. As long as you stay calm, you'll be fine. Okay? So let's kind of reiterate what's going to happen. If you come up to a first aid emergency, you're going to ask the person, are they okay? If they can't answer you, obviously they're not. Okay? You need to verify what's going on. Look at what's happening around you. Okay? Is it a car accident? Is it somebody just fell down and you don't know why? Okay? You're going to safely render aid. Okay? A lot of people, they rush right into something. You don't know if there's gas leaking in a motor vehicle accident. You don't know if maybe something else is going on. Maybe they might be contagious with something. You have no idea. So you want to get to the situation and you want to do it as safe as possible. Okay? Activate EMS as soon as you can. Okay? If the ambulance needs to be there, the faster you get them there, the better for the person. Follow the dispatcher's instructions and be prepared to answer your questions. We'll look at a couple scenarios now. We have Adam, who's a young teenage boy. He's falling down while jogging on a sidewalk. He scraped his knees and his right elbow. He's bleeding slightly, but he gets up quickly. Appears to be in tolerable pain. What should we do? We go back to our steps. We ask, are you okay? We stay calm. We assess the situation, look at what's going on, and safely render aid. Do we need to call EMS? No. You don't need to. Let's look at another scenario. We have Carol, who's an elderly lady. We've known her for a while. She starts to complain about not feeling well. You notice that one side of her face is kind of drooping down. She's just not acting like herself. Maybe she's slurred speech or, one side of her body is really weak. You're not sure what's going on. You know something's out of the ordinary. What do we do? Anybody want to answer? What do you think we do? So we stay calm, you guys. And we're going to stay calm. We ask them, are you okay? Assess the situation, we render aid. In this case, yes, we're definitely calling 911 because this is something completely out of the ordinary. Especially if you've known somebody for a while and they're acting really weird, you don't know what's going on. They could be having a stroke, they could be having some type of symptom that you've never even seen before. EMS needs to get there right away. Okay? Follow the dispatcher's instructions as they give it to you and answer any questions. They're going to ask you things like, is a side of her face drooping down? Does she have weakness to one side of her body? Is she able to even talk? We need to answer those questions because intern dispatchers will relay messages to EMS, and EMS knows what they're coming into. Okay, it's really hard for them to come into a situation and not know anything about it. Let's take a look at the third scenario. And this is a kind of doozy. Hopefully none of us have to deal with this. I've personally had to deal with it, and it was not fun. We're waiting at a stoplight. You notice that the car in front of you has just struck a pedestrian, sending him to the ground. The car's windshield has a head-shaped indentation. The person's not moving. What are we going to do, guys?
Stay calm.
Very good. We're going to stay calm. We're going to assess our situation. Render aid as best we can and call 911 immediately. Okay? EMS will arrive as fast as they can, stabilize the patient. Right? You probably just saved that person's life just by doing that. Okay? So does anybody have any questions at the end of this? None? Are you sure? Because I have a question for you guys. What are you going to do in a first aid emergency?
Stay calm.
Very good. Thank you.